Never in my life. I actually visited my GP and I requested to do a blood check. Just a normal blood check, a health check. And what happened is after the health check, I got my results on my PSA. So the reading was about 3 times higher than the optimum value. I was 59 years old. First thing come to my mind is, why did my machine break down? I had a good Rolls-Royce machine for the last 59 years.
So Kelvin opted for removal of his prostate as treatment for his prostate cancer. For some, that is enough, but for others, additional treatment may be required. Therefore, it's essential to track the PSA blood test closely after surgery. So if the PSA becomes undetectable and remains so, then the patient is in remission. Unfortunately, he had a PSA of 0.13 4 months after surgery, and that rose to 0.23 1 month after. That meant that there was still prostate cancer in his body. I recommended salvage radiotherapy because the surgical pathology had shown that the cancer had grown outside the skin of his prostate, and it was likely that the surgery was not clear there. Together with the slow rise of PSA, suggested that the cancer cells were still in the surgical area and not spread out. And therefore, in such a situation, we could try to salvage it using radiotherapy to eradicate the remaining cancer cells.
Nothing at all. So what happened is, the doctor referred me to Dr. Jonathan Tang. He tried explaining to me what is radiotherapy all about. I was very confused. I was thinking what radiotherapy is going to do to my body. So Dr. Jonathan was very patient. He drew all the diagrams, explained to me what is it all about, the number of cycles that I have to go through, the dosage that he's going to do to my body, and also have given me all the short-term and long-term effects as to what is going on after the radiation and also before radiation. During the treatment, I don't feel any pain at all. There is no stinging pain. Basically, I need to have 2 cups of water. So this is something which I'm very clear. Dr. Jonathan has actually explained to me the purpose of the water. So every now and then I came here, I'm just worried about holding on to my bladder, which is not easy at all. So immediately after the treatment, I have to run to the loo. And also what happened is Dr. Jonathan has told me that there is no hormone treatment needed. So I'm glad.
Some prostate cancer patients who undergo radiotherapy also need to undergo hormone therapy at the same time to suppress testosterone levels, as this may improve outcomes. Thankfully for Kelvin, as he consulted me early, when his PSA was still quite low at 0.1 to 0.2, did not need any hormone therapy. I was confident that he could get a good outcome without the use of hormone therapy.
First of all, I want to thank Dr. Jonathan and everyone at AARO. Okay, when I first came here, I was very comforted. Everybody is just like a friend, and they just talk to me. We were just like friends. We talk about anything and everything. They are very encouraging, give me a lot of encouragement to go through the sessions. The first thing is, my very first session, I was a bit worried when I look at the door. The thickness of the door actually frightens me, you know. They actually asked me for all those music that I love, and then I have told them what are the songs I like. So usually when they start the treatment, they will play the music. So by the time the music ends, everything is over. So that is the good thing about it. Okay, I have a lot of things to do in life. Previously, I may have missed out in the course of my study and in the course of my work. So I want to make sure that I want to lead a fulfilling life now. Whatever that I have missed out, I will go for it. Very first thing that I've already gone for it is the triathlon. My full marathon, which I did last year, a 42.195 training.
I was highly impressed with Kelvin's dedication to fitness after his cancer diagnosis. In fact, I remember that he doubled down on his running from once a day to twice a day. So there's some data to show that vigorous exercise actually can help to reduce the risk of prostate cancer coming back. And therefore, Kelvin was actually helping himself in a big way. So I could see that he took on more and more activities, including marathon running and more lately, triathlon.
In April, I did my first triathlon, and then I did a duathlon somewhere in August. There is the PTO, which is a professional triathlon organization. And apart from these two, I took part in all the runs, Terry Fox, NUS Medicine Run, a total of 8-9 runs for the whole year.
He's as fit and as healthy as he has ever been, and therefore his story serves as a great encouragement for men who have prostate cancer, that they can actually emerge stronger after their treatment. So keep running, swimming and cycling, Kelvin. Well done.
Should I carry on, or do I still want to put a stop to it? I told them no. I'm already more than halfway through. I'm not willing to give up. So I keep going for the marathon, and I finally finished it. It was very satisfying when I reached the finishing line.